So first off, have you guys ever heard of something called Dupuytren's Contracture?
No.
No, Trey?
I have not.
I figured you guys probably hadn't. It's kind of like a rare thing. So today I'm going to talk about Dupuytren's Contracture and actually a pretty easy cure to fix it. And this segment is based on a patient I had recently who let me take some really cool video of me treating his Dupuytren's. And I was like, oh, it's kind of a rare thing, but it is in sort of the realm of plastic surgery. As you guys have heard me probably say in the past, hand surgery is a subdivision of plastics, although there are other hand surgeons that are not plastic surgeons, typically orthopedics or sometimes general surgeons. So, Dupuytren's is not super common, but it is a pretty severe disease. And what it is, it's an abnormal thickening of the fascia of the palm. So we have this fascial layer that runs underneath our skin that gives structure and support to the palm. And this is a disease where that fascia first develops into little nodules and then it develops into cords. And then what happens is it starts to scar and it starts to contract. So your hand will end up going like this, and it goes in a way that you can't extend it. And so I got another picture there, Trey. Yeah, so that's a pretty bad Dupuytren's. You can see that band at the base of his ring finger there, and it's literally pulling his finger forward and he cannot extend it.
It's almost like you can feel the picture.
I know, right? You can totally feel those cords. They feel like it, and it looks like a tendon, but that's kind of a common misconception. It's not anything to do with the tendon. Because the tendons run, through your hand.
Is that an AI picture?
No, it's not. That's a good question, Sarah. I use a lot of AI pictures. That is actually a real picture. Yeah, so it's not involved with the tendon. It's just purely the skin. But when people get this, it's basically, it can disable your hand. I mean, how do you function when you can't extend your fingers? So it does most commonly affect the little finger and the ring finger. The cause is actually unknown. We're not really sure why the fascia starts to...
Isn't it more of like an elderly
That's
situation?
Exactly right. Yeah. Definitely. It's definitely an older population. How'd you know that?
Well, I just know older people I've always noticed that their hands can sometimes they just their hand stays like this.
You maybe have seen somebody that has Dupuytren's.
Yeah.
I mean, it exists, and every once in a while when I'm out in the wild, I'll notice, oh, that person has Dupuytren's.
Yeah.
There are risk factors for it, even though we don't know exactly what causes it. It is hereditary. So, for example, if my dad had Dupuytren's, I'd be more likely to have Dupuytren's. As you just said, it does occur in older people. It starts to come on about middle age, so 40s, 50s. It's more prevalent in men than women, and it's more prevalent in people that smoke and drink alcohol. It's also more prevalent in diabetics, and it's most common in people from Scandinavian or Northern European descent, interestingly enough. It starts as little nodules in the palm, and like I said, those little things pop up. They can be painful at first, and then the little bumps develop into those cords, like Trey, you saying you can almost feel that picture.
Yeah.
And that's a really good kind of description of it. One of the diagnostic tests we use, because this is just diagnosed clinically, meaning we don't take a blood test or an x-ray. Just, you look at the hand, you're like, yep, you got Dupuytren's. But one of the things we do is the tabletop test. So somebody with Dupuytren's cannot put their palm flat on a table like that. They just can't do it. So so when I was in treatment, when I was in training, I remember the physicians I worked with, they didn't like Dupuytren's. Because at the time, really the only cure was surgery. And surgery is kind of morbid. Basically, you have to make a zigzag incision over that cord, and you have to basically separate it and resect it from the skin. And the problem is that thing is really, really adhered to the skin. And so what ends up happening sometimes is the mere fact that you remove that cord ends up killing the skin. And one of the complications of Dupuytren surgery is bad healing problems in the palm, which then,
and then elderly people heal badly anyways.
So I remember when I was in training, a lot of the doctors I worked with just hated Dupuytren. In fact, I didn't love it either. It's very tedious because, of course, you want to separate it from the skin, but then if you get too deep, you're getting down into nerves and things like that. And so when I started my practice here, I actually didn't see any Dupuytrens for a long time, but I had a patient come a couple years ago, not the patient we're about to do a video of, and I was just doing research to see if there's anything new out there, and there are a couple things. And so the treatments are, the main one, surgery. Some people say steroids, but that doesn't really work. There's a new enzyme injection, but the results are kind of, so-so on that. But I read about something called a needle aponeurotomy, which is basically where you numb up the hand, and then you take a needle and you break those cords apart, and then you basically break them to release them. So I read about this. I'd never done one, and I had a patient come through, I don't know, a year or two ago, and I said, hey, there's this kind of newer treatment now. It's more minimally invasive. It's not surgery. We do it while you're wide awake. I was like, what do you think? Well, I've never done one, but it's pretty simple in theory. What do we try it? He's like, yeah, man, I'm totally game. And I did on that patient, and it worked absolutely amazing. And so just recently, in the past couple of weeks, I had another patient come through with Dupuytren's, and since I had such a smashing success with the first needle aponeurotomy, I was like, hey, let me try this. I think it's going to cure you. So I actually took a video. It's a bunch of videos that I strung together. It's over 2 different sessions of seeing this guy. Trey, will you keep my mic on? Because I think that the first part of the video is muted, so I was going to talk over it. Okay, so this is the patient, and you can see right there he's got a cord. Now his is not severe, but it's enough that it's affecting his function, and I'm kind of pushing on that, and like I said, it feels like a hard cord, almost like a electrical cord or something underneath the skin. And he cannot extend his finger. Like you can see it when the camera kind of goes over.
Yeah.
That finger is pulled up. And here's the tabletop test, and you can see that there's a gap. He cannot put his finger flat on the table. So what I do is I use a needle. So this is an 18 gauge needle, and when it zooms in, you're going to see that needle has almost like a blade on the end of it. So it allows it to kind of cut through the skin when you're injecting it, or when you're using it to inject. And so I've already done a couple passes here, but I've numbed this hand up really good with lidocaine. He can't feel anything. And basically I'm taking that needle and I'm just making little holes in that cord, just back and forth, just kind of perforating it. And in a minute, what I'm going to do is, after I've made a bunch of passes, I'm actually going to forcibly extend his finger, and I can actually feel those bands breaking, which is very satisfying. You can almost hear it too. It's like a crunch. And then the finger just kind of relaxes. So let's see, any minute now. I was trying to get that last bit. I'd already done most of it there, but I had one little band left that was holding him. So I was kind of going at it. And he feels nothing. He's wide awake. He's watching me do it. He's doing good.
I wouldn't be able to watch it. Maybe I would. I don't know.
Now here we go. So then I do that, and then now I'm feeling, and I don't feel the cord anymore. It feels soft. So yeah, very effective. Was able to break up that band, and then just do exactly that, and it just broke, and then that contracture is not there anymore. And so I think the next video is him afterwards. Yeah, there's a little bit of audio here.
So before when we did this video, his finger was up like this because he couldn't flat it, and now he's got it flat. Yeah, that's good. Turn it over. Yeah, nice and soft. Better? Make it this. Extend it all the way. Yeah, looks normal.
Then he came back in like a week, I think. Right. Yeah, here's him in a week. A little bit of bruising, but nothing really. Hand works perfectly. Can fully extend, can flex, can put his hand straight down on the table. So.
Nice.
Yeah, pretty cool. I like in medicine whenever we make advances because that kind of thing was not done back when I was in training. Yeah. And it's like some smart person was like, oh, I'm going to take a needle.
It's way more simple.
It's way simpler. Yeah, it's less risky. I've now have 2, not a ton, but 2 patients I've done this on just in the office. It took me about 20, 30 minutes and basically completely cured them. I think that if somebody had it really severe, it might be optimistic to think that would work. But I will say that the person I did before had it much worse. He had like 2 fingers on each hand. And so we did one hand one day, then he kind of recouped and he came back and did the other one. But it was the same outcome. That guy was kind of more like this. Yeah. And I was able to get him all the way out. So that guy was super happy too, that the guy in that video, first off, he was super nice, let me take video and let me use it. But he was very thankful because he's like, I was really afraid of having surgery and this was very simple, and he just was very thankful. So it's kind of cool.
Hands are kind of important.
Shout out to him for getting
Yeah.
cured, but also shout out to him for having really clean like fingernails for the video. I did notice that his fingernails are really clean. Shout out to the guys with clean fingernails.
I'll let him know when I see him.
100%.
Yeah. No, he was well put together. Yeah, well spoken guy, and so anyway, so Dupuytren's contracture. Yeah, so